Hi, welcome to the Reframing Eye Care podcast. I am your host, Dr. Maria Sampalis. We have the CEO of Barti with us today, Colton. Welcome to the podcast.
Thanks for having me. Really excited. Long-time listener, first-time guest. So excited to be here.
Yeah, it's Barti's done a lot of great things in the industry. Is really revolutionizing EMR. I mean, it's great to see the things that your team is doing. Colton is the CEO and co-founder of Barti. Barti is a modern EHR and practice management software specifically for optometry and powered by AI. Previously, Colton worked as a management consultant and entrepreneur at Bain & Company, where he developed new software for Fortune 500 organizational transformations and also built his own knowledge management venture within the firm's accelerator. So quite an intro. Welcome. It's great to see you innovating and helping optometry move forward.
Thank you. Yeah, we're really excited. We work with a lot of corporate sublease doctors, so this community is very near and dear to our hearts. And so I'll also thank you to all you do for the profession broadly. But yeah, excited to be here and chat a little bit.
Yeah, thank you. You know, it's great to see that you guys are innovative, because when I talk to a lot of industry partners, corporate optometrists are kind of not on the list of business strategy. So it was great when you first started to know that you guys saw the value in this set of optometrists. So again, I thank you for that, because it really helps, move our industry forward and really change some of those misconceptions, again, in our industry.
Yeah, and we'll talk about that hopefully a little bit, but that is a big goal of Barti in general, is to push the profession forward on the tech side and really bring optometrists to the forefront rather than kind of the laggards of the tech world.
Yeah. Give us your journey, share your story on Barti and how its inception and where it stands today.
Yeah, really excited to share. So Barti is the newest EMR company. We're about 3 years old. And we were started when me and my co-founder, Dr. Kelly Kai, who's an optometrist, we really listened and heard so many pain points from doctors around the country about their current EHR. So we launched about 3 years ago. And today we are in over 30 states. We have a full platform that handles the EHR, as well as the patient texting, online scheduling, and now an AI Scribe as well. So we're the only EMR in the industry to have AI built in directly to the platform. And, we're really excited to continue to build it out so you have one system you need to run the whole practice.
Yeah, I think that's going to really change in general AI in our industry. Tell us what inspired you for the creation of Barti and how it's different from the traditional EMR systems in the eye care industry.
Yeah. So what inspired the beginning of Barti was just hearing from over 150 practice owners around the country that they hated their EMR. We did an exercise where I cold called 150 practices. I said, answer one question, scale from 0 to 10. How likely would you be to recommend your current EHR? And the results were horrifying. What we found was people are spending half of their time documenting patient visits. So for a 30-minute appointment, there's 15 minutes of documentation time associated with that. And studies show in general in medicine, EMRs are actually one of the root causes of doctor burnout because it leads to so much documentation time. So that was the first big thing we heard, is it takes over 100 clicks to document one routine eye exam in most of the legacy platforms. The other big thing we heard is most owners have to juggle 3, 4, or 5 different disconnected systems in order to run the platform, in order to run the business, meaning they have something for texting patients, they have something else for their EHR, et cetera. And so Barti wanted to do 2 things: make documentation a lot easier and combine a lot of the functionality so you don't have to have 3 different tools to run the business.
That's great. Great to hear. I mean, you guys are doing a lot with AI, and I think the forerunner with in the EMR space with that, and that's what everybody's talking about today. Can you share more about how you're using it and what's like more ahead to help doctors utilize AI in their practices?
Yeah, I think this is one of the biggest things that separates Barti from other EMRs is how quickly we move. We've built all of our functionality in under 3 years. Now we have AI functionality we're going to build on, double down on, and continue to move and innovate much more quickly than any of the other legacy platforms. So that's our advantage, is speed. And we're going to continue to move very quickly. So today already we have people using our AI Scribe. That's the big headline for me, is a lot of people, like you said, Maria, are talking about AI, but how many people are really using it in their practice? I know you do. I know you're one of the few people that actually are really using it probably on the daily basis, but we're the only ones that have that in the EMR today. And the way that works is it's an AI Scribe. So within Barti, you can record the conversation, and it will not only transcribe, but summarize the information for you and put it directly into the Barti chart. And so other studies have shown in other settings using similar technology, it can save doctors up to an hour per day. And that's how accurate it is. It's over 95% accurate, which means it ultimately is just saving the doctor tons of time. So that is something that we have today and going to continue to advance and make better.
Yeah, I think it saves the doctor time, but it also maybe on the bottom line too, with less hiring of scribes and things like that. And maybe seeing more patients having a scribe, but maybe the scribe is doing the more complex cases where maybe the AI too is doing the more routine, and while you're talking out loud and kind of save that too. And I think that's important. I've been doing some research with AI, and I find that, I've seen, and the AI also helps with making sure that the charts are more thoroughly written instead of kind of rushing through and just writing like a summary of like RX objective or whatever the case is, latanoprost, one drop, and then move on. And instead of like what we were taught in school to thoroughly, write a decision plan. So,
yeah, it actually turns out, again, other studies have shown, and we've seen this with our customers, the notes are higher quality. There's actually more detail there than when the doctor has to spend an extra 20 minutes to click and type to add that extra detail. And so you actually end up with notes that are better. And the other thing you hit the nail on the head, Maria, is you ultimately can see more patients or earn more revenue. So Carbon Health, which is a major chain of health clinics, their AI Scribe has led them to see 30% more patients.
Wow.
Since they deployed it, because of how much time savings they're able to deliver as a result. So that's a big opportunity. And then also excited to tell you about our newest AI product that hasn't been released yet and hasn't been announced yet. But this is something we're hoping to have in advance of Vision Expo West, is an AI assistant. So imagine an AI that can answer the phone, sound just like your staff members, ask the right questions to the patient, take down their info, and then book the appointment. And you'll never have to miss a phone call again, because it never gets sick. It never calls. It never shows up late. And it'll work 24/7.
That's truly innovative. I don't think there's anything out there right now in eye care that I think a lot of companies have virtual assistants that are, overseas. This is something that is amazing too, to be able to help with the front desk, but also with it's hard to find staff now, and all these this is probably a more affordable as well than, virtual overseas assistants that maybe might have some turnover. The AI is never gonna quit on you, right?
Yeah, and it's the biggest obstacle to growth we hear usually, is how difficult it is to find team members. And so what this will let you do is use your team members, like you said, in a more effective way, where they can deliver a better patient experience for the patients that are there in the door, and spend less time going back and forth to the phones. And so that's really what it allows you to do, is continue to grow, see more patients, invest more time in the business without necessarily, like you said, killing the bottom line.
Yeah. So doctors are typically seeing EHR as something that they have to use. They don't really like it. People are always picking the worst ones, is what they're saying. What is your customer experience with Barti, and how has it been different?
So we're really proud of the fact that we've kept 100% of users on Barti since we launched. So we've never had a Barti customer that switched to another system, and probably will not always be like that. But knock on wood, we're very proud of that. And part of it is because we're 10 times easier to use, which means getting started is super easy, and the ongoing usage is really easy. Specifically, it only takes 1 or 2 hours to get fully started with Barti. And so that's something people really appreciate. But more than anything, it's the time savings day to day, where all of our functionality links perfectly. The intake form, the online appointments, the texting, all of your data for your patients is in one place in a really easy to use system for your staff. So we have really high customer satisfaction. We've never lost a customer. And so for us, we're the first EHR you will ever love. That's sort of our tagline. Instead of the least of all evils or the least worst one, we're the first EHR that you'll love if you give it a chance.
The doctors are, want to switch EHRs, but they find like there's a lot of hurdles to do so. What is your experience and advice for doctors wanting to switch?
So what I hear all day, every day is I don't like my current system. I like what I see with Barti, but I don't want to change because my staff is going to mutiny and I don't want to learn something new. I'm worried about my data migrating over. And so the number one thing, if listeners are, that I hope listeners take away from today is that getting started with Barti really only takes 1 to 2 hours, including everything. How do we do that? We handle all the data migration end to end. So we'll get all your data. And more importantly, it only takes us 1 hour to configure your account and roughly 1 hour to train you and your staff. And so ultimately, it's a basically no downside way to try it out. We also have a free trial. So there is actually a no financial cost way, but even just 1 hour of people's time is enough for them to then start kicking the tires. So usually I tell folks, don't let that be a barrier. If you think there's inefficiencies in the practice, if you don't like your current system, the grass is greener on the other side.
Yeah. What's one thing you wish people knew about EMR systems?
I wish people understood that it is the gold mine where all of your data is stored.
Yes.
And
yes.
There are so many doctors I talk to that are truly flying blind, Maria. And I'm sure you see this as well on their business. They couldn't tell you how many patients they saw last month. They couldn't tell you their top line revenue figures. They couldn't tell you their no-show rate. There's a ton of very key data that they really have not even a directional sense of. So that's something I wish people knew and appreciated is the data you put into your EHR ultimately can contribute to very valuable insights, data, analytics, reports that ultimately let you move the needle, whether it's, again, dropping the least profitable insurance, making sure your no-show rate is in line with industry averages, making sure that your patients are getting the communications that they need on the right timing. The EHR is really an unsung hero, I think, actually, of the practice, because it's the lifeblood. It's where all the data is. It's the source of truth. And so that would be my one call to action.
No, it's very important. I think data is very important for growing a business, knowing if you need to add a doctor, add a staff. I kind of can look in my EHR. I can kind of see or do an audit of the day, see which charts they open, how many recalls they've done for patients that haven't showed up in a couple of years, where the system doesn't do it for like your yearly stuff like that. I think it's just a great way to get a snapshot of the practice, know the busiest times of the year, to maybe maximize revenue or see more patients, add more hours, or maybe decrease hours. This time of the year for me in July, I'm like, oh, it's not busy. I'm out. I'm going to enjoy the summer. July is usually slow, but I know come August, it's going to be busy again. So yeah, data is so important. And, a lot of doctors don't know it, or a lot of doctors give it away. And the EHR is an easy way to have a snapshot of your practice, and also use it to kind of compare what others are doing in the area and in the industry to kind of know where you are. So if you think you're doing bad and then you realize that you're kind of average, you're not as nervous per se. And I look at like the Jobson Optical reports each week. We had a bad week this week. I was like, all right, everyone was down this week, So totally. It's kind of nice that way too. So yeah, you're right. Data is so important, and EHR is a great way to capture data, and you're not even doing it. Your staff's doing it.
Right.
But even from the business side point, I think even from medical, I think is important too. You can kind of we data mine and say, we have these much of glaucoma suspects. I just got a new instrument, or can I buy a new instrument? We have this. Or even when I bought an OptiLight, was an investment in the practice. We had a lot of dry eye patients, and I said, okay, we can do this, and we can target these patients and call them and market to them directly, because we had that information. We made a smart business decision to purchase equipment.
Yeah, and then you can do that segmentation and really act like a sophisticated business in 2024. Which is what everyone else in every other industry is already doing, is targeted marketing. It's a huge opportunity, I think, for a lot of ODs.
No, it's exciting to see to see the team, expand that. I mean, there's so much possibility with that, and I'm looking forward to seeing that in September at West.
Yeah.
Where else can we find Barti, and where else can listeners learn more?
We are at a lot of conferences and shows, so check us out at Vision Expo West, Vision by Design, the GRT Summit, all coming up shortly. And then reach out to me directly, colton@barti.com, if you have any questions. And of course, you can see customer testimonials, product video as well on barti.com, and schedule a demo.
All right. Well, thank you so much for coming on the podcast, sharing the latest innovations in EMR, in eye care. Hopefully we can get the other ones to kind of follow. I mean, starts like to be innovative, adapting with eye, and really gonna hopefully dominate the industry in the future.
Yeah, they got to keep up. So we're going to be moving quick. So yeah, really appreciate the support, Maria, and thanks for the time.
Thank you. Bye-bye.